Now we're going to talk about the health care debate. Of course, it is being voted out of the Senate committee today. And Sandra is joining us now with someone from the insurance industry that has a few words for those lawmakers. Good morning.
Good morning. Thanks, Dan. Yes, it is the big story today, health care and the vote by the Senate Finance Committee. And joining me right now is Craig Gussin. He is a health insurance broker to talk about this news from the insurance industry. They kind of pulled a fast one yesterday, kind of bringing out this report at the last minute on the eve of the vote and talking about some of their concerns. I guess number one being that premiums could go up quite drastically for people who have private health insurance.
They could, and what they're talking about is the same thing that I've been saying and most folks have been saying for a long time, and that is every time Congress or Medicare cuts payments to doctors and hospitals, the doctors and the hospitals turn around, charge the insurance companies more money, and the insurance companies, what they do is they end up sending that over in higher premiums. So yeah, rates are going to go up. So there's two issues to deal with. One is every time you hear the word cuts or mandates by the government for any type of health insurance issue, then that means it's more money it's going to cost the insurance company to provide health care.
And somebody is going to have to make up for that shortfall.
Exactly, and it's you and I.
So their report that they're referring to, a lot of their concerns, they're legitimate, they're true, and they could in fact happen.
Oh, I think definitely those numbers sound pretty right on. And at one point no one's talked about is we have, even with the new Senate bill, we have 25 million people uninsured. So if you don't, Sandra, if you don't have health insurance and you go to a hospital, we have to treat you. It's just the way it works in the United States. Who's going to pay for you? The hospitals are going to end up eating it, but they're not. They're going to turn around, charge higher rates to the insurance companies, and they're going to end up charging higher rates to the consumers. So,
you know, what's happening here, it's very frustrating for people who work hard and buy their own health insurance, and they're going to be the ones that are screwed in this deal, basically.
Unfortunately, what you're seeing in the Senate is very sad because they're still going to only, they're only going to bring down the uninsured 12 million, but yet tomorrow morning I could bring it down 16 million by covering all the kids under S-chip, under healthy families. We could also, the fines are $400. If you don't have health insurance, they're going to fine you $400.
Now, if you don't have health insurance, it's probably because you can't afford to pay for it. So, well, what are the chances you're going to be able to pay a $400 fine?
Per year. Well, $400 fine, I'm thinking to myself, why would I want to buy health insurance if my fine's $400? My health insurance is going to cost me a lot more, probably $400 a month.
Now, this vote that's happening today, this is one of 5 bills.
Yes.
One of 5 that's being bantered about. So, ultimately, in the end, it's going to be what? A kind of a melting of the 5 bills? What's going to happen?
What's going to do is, this is one bill that came out and they said it's going to be revenue neutral. But that's assuming that they're going to have this tax on Cadillac plans, which is never going to pass. And once you get all the politicians in there saying, I don't like this, I want this thrown in, it's going to all change. And when you get the different bills together, who knows what's going to come out. But at the end of the day, it's probably going to be a bill that's going to cost at least $1 trillion or more. And you talk about Medicare savings of $451 billion between cuts and other things. It's not going to be there. It's going to maybe be $1 billion at tops. So I think the projections that we're seeing aren't really true.
Now, you're obviously a representative for the insurance industry.
I'm a broker. I'm self-employed. I am a broker. I work with clients all day. I get paid by the insurance industry to sell their products to the consumer. But my first goal is, first, I'm a consumer, and I worry about one day when I retire about Medicare. What am I going to have to pay for? And I don't want to find out when I'm 65, 75, 85 years old, I can't have a procedure done that maybe my grandparents had because of the healthcare system. So for me, I look at it as a broker of what's best for the consumer and what's best for all of us.
Well, let's hope that of those 5 bills, they'll take the best parts for the consumer in their final decision. Craig Gussin, thank you very much.
My pleasure.
Appreciate your time this morning.